So we're here at the decompression table. We're actually going to be also doing a neck decompression. So we've done a couple other things already for the ankle. So we're going to actually be doing a decompression for the C5, C6 disc in the neck, which has an extrusion, like a little popping out of the disc bulge. It's irritating the spinal cord. So we want to have it at a specific angle. We want to make sure this is snug but not too compressive. And so in the neck decompression, what this is going to be doing is going to be expanding the disc, creating nutrient flow and circulation into the disc to help the cells get more nutrients, oxygen, and water that will actually help those cells that are inside the disc repair that area. And this traction also creates a negative pressure, which actually sucks in the disc, taking the pressure off of the nerve. Doing this repetitive over multiple times ultimately is shown clinically to actually reduce disc size, reduce inflammation, and help create stability for bulging and herniated discs, helping people avoid surgery. And what will happen is this process will slowly ramp up tension, get to an apex, and then drop back down, and then come back up and drop back down over multiple cycles, creating a pumping action. That pumping action is what creates the circulatory flow for the disc, which doesn't normally happen, and doesn't happen if you just traction your head or you hang off of a bar or something like that. That doesn't happen because your neck is, when you have a disc bulge, your neck is actually got muscles that contract and spasm and protect that area and restrict it from motion. But it also restricts it from that expansion and contraction that is needed to help the disc get nutrients. It's quite comfortable, right? Right. Process is pretty painless. Process takes about a half hour, and ultimately we follow up with chiropractic adjusting, deep tissue laser, ultrasound, things like this to help people recover without the use of drugs, without the use of surgery. It's a very effective technique. I've used it for over 10 years now, and it's one of our go-to techniques for helping people with disc herniations.